It's time for a CCO student webinar. We're on number 61, and we're going to be talking about hypertension. The reason coding for hypertension is really, really important is there's diversity in it. We were just talking about diversity before we signed on, some of the background chatter for us. There really is some diversity in hypertension because hypertension affects multiple body systems, and it is a disease in and of itself. And there's lots of names for hypertension, like secondary hypertension. Well, here we've got them listed on this slide. Just basic hypertension is I-10. Most people, when you decide that you're going to become a coder and you start taking your training, that's the first code you learn, and you probably get it memorized. It's a very common disease, and because it's in the ICD-10-CM code set and it's I-10, essential hypertension, very easy to learn it and memorize it. But there's more than one name for hypertension, and let's look at those. If a person has any of these high blood pressure or hypertension types, then they're I-10, which basically boils down to plain old hypertension. You may see a provider document it is arterial hypertension, benign hypertension, essential, malignant, primary, or systemic. Now, you think, well, how can it be malignant and benign hypertension? In the past, when we had ICD-9, we had different codes for some of these. But when ICD-10 came, they pulled all of those together. Ultimately, we have more diversity in ICD-10, but what they did is they separated out some of the other types of hypertension, and we will talk about those today. Any coding exam that you take, I guarantee you'll probably get at least 4 or 5 questions that deal with coding hypertension. So I want you guys to have it memorized. Now, again, I don't have all the hypertension codes memorized, but there's some basic guidelines that I think you need to have memorized, and I'm going to tell you what they are. And I am really, really good about telling you, this is something you just need to be aware of. No, this is something you need to memorize. And when I tell you that, I want you to write it down. Now, of course, if you're one of our students or you're in the CCO club, you're going to be able to have access to this slide deck. And therefore, you're going to also get a transcript of what we're talking about, so you can go back and reference it. But whenever you come to the student webinars, it's really ideal that you have one of these little notebooks or something with you, so you can jot down some of your codes and notes, and then come back and make notes, jot notes in your books and things. Okay. That's just the way I learn. I want to look something up, research it a little more in depth, so I'll go ahead and write it down. Now, first thing I would write is hypertension is abbreviated HTN. You're not going to see people spell out hypertension in the medical field. They're just going to write HTN, even if it's another type of hypertension, HTN. Now that everything is electronically done, you still see people using HTN. So with coding hypertension, what do you need to know? Well, you're going to have to know the anatomy of hypertension. We are going to go over that. But first, I'm going to talk about how we code it. Then we're going to talk about understanding the disease process. Usually I flip that around and I want you to understand the background, but first, these are guidelines or rules that you're going to need to know. And that first primary thing is that hypertension affects the heart and the kidneys. Now, they affect other parts of the body, but the biggies that have a presumed or causal relationship, and those are two terms that you need to jot down if you're new, if this is, you're just starting the course. You're going to write HTN, you're going to heart and kidney, and then I want you to put presumed causal relationship. Ultimately, what that means is if a person has hypertension, they're probably going to have something wrong with their heart eventually and or their kidneys. If a person has a problem with their heart and or their kidneys, they're going to probably have hypertension. If a person has a problem with their kidneys, then they're probably going to have hypertension. Okay, so the causal relationship is hypertension causes kidney dysfunctions, causes problems with the heart. Kidney problems causes hypertension and causes problems with the heart. Heart problems causes hypertension and kidney dysfunctions. All right. Now, it may not be instantaneous. However, long-term hypertension starts wearing on the rest of the body. How do you think of hypertension? Well, we know that the heart is the pump of the body, right? And hypertension is caused by the vessels in the body under too much pressure. That is exactly what it is. So why are they under too much pressure? Because the kidneys aren't filtering waste properly, or the heart's not working properly. It's working too hard and straining the vessels, or the vessels are getting older and wearing out, and therefore they're straining the heart and the kidneys. So again, causal relationship. Another thing to note that I would put in my notes is that if there is a causal relationship, then you're probably going to end up with more than one code. Okay, so instead of coding the I-10, which is straight out hypertension, you're going to use another hypertension code, but then they're going to want to know what's the type of involvement with the heart, what's the type of involvement with the kidneys. So again, there's going to be combo codes and other codes that are going to need to be dealt with. All right. There's always a causal relationship. Maybe I better put this last sentence in here. It says, however, if the documentation specifies that the patient has hypertension and CKD that is not related to the CKD, the hypertension is not related to the CKD, then you don't combine them. You would code the I-10 and then you'd code the N18 point, whatever the stage was. Okay, but otherwise, causal relationship. So the coding, what are we going to look at? The first thing, or the second thing now, I guess I should say, is that an elevated blood pressure without a history of hypertension, you are not going to use I-10 because I-10 is hypertension. You're going to use a signs and symptoms code, RO3.0, which is blood pressure, elevated blood pressure. Now, if they write the term high blood pressure, that's I-10. Okay, that's a disease. But elevated blood pressure is different. It is the person just has white coat syndrome, or the person just has a higher than normal blood pressure, but it's not hypertension, because hypertension is a disease, and when we go to the doctor, what happens? Our blood pressure goes up. I got a cute comic at the end I'm going to show you that kind of drives home. Therefore, I would write in my notebook RO3.0, elevated blood pressure. And then I would write I-10, high blood pressure. Okay, what constitutes one from the other? The word elevated versus high, or the patient just doesn't have a history of hypertension. Once you get hypertension, it doesn't go away unless it's related to something else. Always note, in almost all of these codes, you're going to have obstetric codes. If a patient is pregnant and she gets high blood pressure, then it's going to be an O code, an obstetrical code, 013 through 014. Okay, so it's kind of like secondary hypertension. You wouldn't have had the hypertension if you weren't pregnant. And it's going to go away once the pregnancy is over. Unless your patient had hypertension before they became pregnant. If that's the case, then they would be I-10 and then the pregnancy codes, okay? Not in that order per se. O codes always trump and go in front of other codes. And the official guidelines for that are in section 1, C9A. If you want to go look at your guidelines, I don't know what page it is because every year the page changes, but pretty much always that is the code section area in your guidelines. Or you can make yourself this little box and just put HTN, I-10, and high. That's not supposed to say high blood pressure. That's supposed to say elevated blood pressure, RO 3.0. Okay, elevated blood pressure. Actually, let's just exit that real quick and change it while we're doing it because I don't want it to make us mess up. There we go. Perfect. Now I can go back to present from the beginning. All right, that looks better. Elevated blood pressure is RO 3.0. Okay, moving right along. Ooh, look at all these words. I should have made them a smaller font, but I got to where I could fit all this in there. Now we're going to move from I-10 to I-11. When you look up I-11, the codes are going to be for hypertensive heart disease with heart failure. The /C means with, the /S means without. Now, I don't like writing with or without because I grew up in the era when we did medical abbreviations, that's what we used, and it sure shortens having to write. Saves you space on your slide deck too. So /C is with and S is without, which is actually, they stand for Latin words, which I don't remember what the Latin words are. I-11.0, hypertensive heart disease with heart failure. That means when you go look at I-11.0 in the tabular, it's going to tell you code the heart failure as well, which is like an I-50 code, right? Hypertensive heart disease without heart failure is I-11.9. So you won't be using an additional code for that. A lot of times, codes that end in a 9 are for unspecified. In this instance, it's not. It just means without heart failure. So the patient not only has hypertension, they have hypertensive heart. And that is different than hypertension. It's a different disease and disease process. Therefore, it gets a different code, I-11. You have two options, I-11.0 with heart failure, add another code for the heart failure type, and I-11.9 without heart failure, you don't need an additional code. I-12 has a couple choices as well. Now we have hypertensive chronic kidney disease, CKD, with stage 5 chronic kidney disease or ESRD, which is end-stage renal disease, which I should have just typed ESRD because that's a whole lot easier and fits in there better. Note for your notebook, ESRD is end-stage renal disease. If a patient has stage 5 or end-stage renal disease, that's CKD stage 5, they're on dialysis. You're going to also use an additional code that is for the CKD or end-stage renal disease, which is N18.5 or I think 0.9. I can't remember what ESRD is. You can look it up, but you will code another code besides I12.5. And CKD is N18 point dash, meaning there's another code, another number that you need or character. Then we have I12.9. Again, we have hypertensive chronic kidney disease, meaning our patient has hypertension and CKD with stage 1 through 4 chronic kidney disease, CKD, or unspecified chronic kidney disease. Sometimes you get unspecified, but a lot of times they're so in tune to documenting what stage it is. If you have stage 4 or then you it risk adjusts, so they're very attuned to that. I12.9 with stage 3 CKD would be I12.9, comma, N18.3, because it's stage 3. All right. More about the coding guidelines that hypertensive chronic kidney disease is either going to be chronic kidney disease, CKD, that's being caused by the hypertension, or sometimes it's CKD causes the hypertension, also known as renal hypertension. So you might see that verbiage. So either the patient has CKD that causes hypertension, renal hypertension, or the patient has, they either have CKD that causes the hypertension or they have hypertension that causes the CKD. One or the other. Very, very common. Almost always you're going to find a CKD person having hypertension. I don't think I've ever coded anybody that had CKD, even if it was, a really low stage like stage 1 that they didn't have, in addition to hypertension. Your blood pressure, one of the most causes of CKD, I think we stressed that. And it just ultimately it damages the kidneys. The kidneys filter the blood. And think of it this way. Say you have a coffee strainer, right? And you use that coffee strainer, that one, again and again and again and again, right? And you're pouring the water through and you're just giving it more water and pressure than it can stand. Or let's say you're going to wash out your coffee filter and you run it under the tap water and you shake it around and use your finger and you kind of clean it up a little bit, right? Okay, well, it'll probably work. Now, take your little spray hose that you get with your faucet, if we're lucky, and then turn the water up to as high as it can go, squeeze that, and then spray it off. Chances are you're going to tear the coffee filter. So your kidneys are the filter for your coffee maker. What happens when the filter gets gunky and doesn't work anymore and work as well? Bad things go through and affect the kidneys or your coffee cup, and then also it doesn't strain as well, so it backs up. Let's see. I really like this little heart I found because that's a heart and then that's the shape of the kidney within the heart. I thought that was pretty cute, wasn't it? Yeah. Another code, I13.10. Again, this time it's hypertensive heart and CKD without, because it's the S, heart failure and stage 1 through 4 chronic kidney disease or unspecified kidney disease. Now let's break that down so it's not so many words. So we have hypertensive heart and we have CKD. If we have hypertensive heart, that means we're going to maybe have heart failure. Do we have heart failure? Well, in this case, we don't. 0.10 says we don't. So we're not going to need an additional code to describe the heart failure. But we will need an additional code to describe what stage of CKD we have. How do you differentiate the I12 with the I13? Well, I got a simple way to remember it. If you see I12 codes, that means you have two things happening. You have hypertension and you have CKD. Very good, right? Two things. If you see I13, you have three things going on. You have hypertension, CKD, and heart disease. Three things. Therefore, it's a 3. Is that easy to believe, right? I like that. That's all you have to remember. And whenever you code CKD, you will always code a stage. Always. CKD will give you a stage. 1, 2, 3, or 4. Now, if you have stage 5 or ESRD, then it has, it's a little different. So let's break it down one more time. Hypertensive heart, CKD, and so we've got hypertension, CKD, heart failure, without heart failure. 1, 2, 3. I13.11, hypertensive heart, CKD with heart failure. Three things. Okay. In this time, you're going to code the CKD or the ESRD, but you're also going to code for the heart failure, which is like an I50 code. So you're going to have your your I13.11. That means there's three things going on because you see the 3 in the code, right? So that's I13 means I got three things going on with my hypertension, CKD, and heart failure. Excuse me. What's the difference between 0.0 and 0.1? Go back. 0.0 without heart failure. With heart failure, 0.11. Now, you don't have to have those memorized. What I want you to have memorized is I10 is plain old, good old American hypertension, right? I12 is hypertension, CKD, two things. And then I13 is hypertension, CKD, and heart failure. That's what I want you to have memorized. Those three things. So write those down in your notes, however it helps you to remember them. Very good, very good. But we're not done. We have I13.2. Well, what else could there possibly be? Hypertensive heart disease, CKD with heart failure, and then it says with stage 5 or chronic kidney disease or end-stage renal disease. And you think, wait a minute, didn't we just say that? Because this is without heart failure with stage 5 or CKD. And then this one is with. So I may have just said that wrong in the previous slide. All right, don't forget, this is with the C, and this is without. Got it? Both of these are going to be on dialysis. And because they're both ESRD or stage 5, and you can't have ESRD and not be on dialysis. So that's an additional code that's going to go. Now with this one, we do without heart failure, we don't have to code the heart failure. But here, we're going to code the I13.2. We're going to code the ESRD. We're going to code the heart failure. And we're going to code for dialysis that the patient's on. you kind of get an idea how easy it would be to make sure you understand all these codes and write test questions. Really, really easy to do. And so that's why you're going to see this again and again and again. They want to make sure that you're coding it correctly and at the highest specificity. Now, that's not it. Those are the main ones. Those are the ones that I want you to have memorized. I10, I12, and I13. There is also secondary hypertension. Secondary hypertension just means you wouldn't have hypertension unless it was secondary to something else going on in the body. There are five options here, and they're I15. So there's 5 types of secondary hypertension you can code for, and how are you going to remember that? I don't know. You could come up with something weird, I guess, that I10 means 10, but secondary is half of that because it's second. I don't know. Don't do it like that. You come up with an idea, but you don't have to have secondary hypertension codes memorized. They're not used as much. It's not as common. Those other ones are the ones that you're going to get tested on. I10.5, renal vascular hypertension. That means, let's break down the word. The vascular system that goes to the kidneys has a problem, and so therefore it causes hypertension. Renal vascular hypertension. And we know already, we've already established that the kidneys and hypertension have that relationship. I15.1, hypertension secondary to other renal disorders. So it's not the vascular system around the kidneys that's causing the hypertensions. It's some other renal disorder that's causing it. I15.2, again, secondary to endocrine disorders. Now this could be endocrine or would be glands. So it could be the thyroid gland causing it. You have a thyroid issue. I don't know what it would be, hypothyroidism or hyperthyroidism, which would probably be hyperthyroidism. And that endocrine disorder is causing hypertension in the body. And again, we have the adrenal glands, even though they sit on top of the kidneys, it would be an endocrine problem because it's a gland, not a other renal. Even though those glands are sitting right, they're just cupped right on top of the kidneys. And then I15.8, other secondary hypertension. What does other stand for? And it's usually coded with a 0.8. Other means it is documented. The provider knows what it is. They've documented it, but there's not a code for it because we only have 5 codes for secondary hypertensions. And until there's a code for it, we would code I15.8. And then I15.9 means unspecified. They've stated that the patient has secondary hypertension, but they didn't document what it was secondary to, so we don't know. Therefore, it's unspecified, and that would be a 9. Almost always, but not 100% of the time, 9 is classified as unspecified, and an 8 is usually other. There are some odd cases where 8 ends up being unspecified or something else. So, but as a general rule. Hypertensive crisis. Hypertensive crisis, very, very different than anything else. It's I16, 3 codes for it. I16.0, or hypertensive urgency, 0.1, hypertensive emergency, and 0.9, of course, hypertensive crisis unspecified, meaning we don't know. The provider hasn't given us the documentation. It could be just that the provider doesn't know yet either. We need to do more testing. So unspecified has its place. And I know a lot of people say, well, we should never use unspecified. Well, when you first start treating a patient, it's very likely they will have unspecified until lab work comes in or the test results come in or they go to a specialist. right? A cardiology department, or maybe even renal could give a higher specificity. So what does a hypertensive crisis mean? It's malignant hypertension. You think, wait a minute, I remember on that list that we did on that first slide, malignant and benign was I-10. So why are we saying hypertensive crisis is I-16? Well, what happens is the blood pressure is 180 over 120 or higher. And let me tell you, that's high blood pressure. There are two types of emergency and crisis, and then both require medical assistance. Now, malignant means that it's kind of all over the place. It's up and they can't control it. Um, benign is more or less the opposite of that. So a hypertensive crisis means this is sort of like a sudden onset. The blood pressure goes up, and this is really severe. 180 over 120. That, first of all, you don't want those two numbers getting too close to each other, because then you die. And then the other thing, having a bottom number over 100, I mean, that's really critical. And 180 is going to start giving you side effects, right? That bottom number, so you got your systolic and your diastolic. That's the silent killer, because you don't get signs and symptoms. However, that top number, you do. That's when you get the signs and symptoms, and we're going to talk just a little bit of those on our last slide. So that's an emergency. I mean, that's a problem. One time when I was pregnant, I was having high blood pressure, and I remember they told me to stay home and in bed, and my blood pressure was 150 over 110. And I'd walk down to, we lived in town, and I walked to they were having the turkey festival, because I lived in a small town and they had festivals. And so it was literally just 2 blocks to the pharmacy downtown, and they were having a job fair, and I had worked there, and I was pregnant with number 2. And they said they were having this health fair, and I said, well, you can check my blood pressure, because the doctor told me to stay home and go to bed because my blood pressure was elevated. And she said, then why are you walking down here? And I said, I know, but I just wanted to get out and get some fresh air. And when she checked my blood pressure, she checked it twice, and she said, you go back home and go to bed and don't get up. Like, okay. That was really, really bad. Hypertensive urgency. Now, this is not as bad as a crisis, and you can usually treat it with medications, right? So you're not going to have organ damage. However, hypertensive crisis, we're looking at damage. I mean, the dam is going to break, and we're going to flood out the riverside. You got the lake, you got the dam, and then you got the riverside. There's a crack in the dam, and you're going to flood out all those homes down at the bottom of the dam. If you've never seen that happen, I have. It's really tragic. And then we have hypertensive emergency. This is even more severe, of course. Immediate medical attention. You've got organ damage and chest pain. You got the whole 9 yards. And honestly, this is usually when people stroke out or have a heart attack. It's imminent, something like that. So that's just a little breakdown if you don't know what the urgency, emergency, and crisis stand for. Now let's talk about why we need to know these codes. What is the anatomy? Understanding hypertension. And again, like I said, I usually go back and do this first, but this time I chose to really pound in those codes. It doesn't matter what the medical condition is, but high blood pressure is a disease, and it's mostly associated with chronic kidney disease. This is essential or primary hypertension is the basic. Sometimes you don't have any signs and symptoms. You just go in and they check your blood pressure. Oh, it's high. Well, maybe it's because, I'm coming to see the doctor. I don't have any signs and symptoms. I didn't know I had high blood pressure. And then, they have you sit in the office and everything, and they check it a little bit before you go home. And it's like, oh, yeah, look, it went down significantly. Yeah. Or they tell you, go get one of those little blood pressure machines, automatic blood pressure machines that you can get at the pharmacy now for less than $20. And every morning and evening for a week, check your blood pressure, write it down, keep a log, and call me on Friday and let me know what you found, right? Blood pressure, it's typically considered normal at 130/80. Now this changes a little bit, and also the older you get, they give you some more points there to go up, because honestly, you're going to have the heart works harder. The vessels are wearing out, and you can see how tiny these vessels are. And if you wondered, that's actually the vascular system of a real body. They have a way now of melting away the body at different parts and preserving the different structures, and the blood vessels is one of them. They actually inject into the body, the cadaver, this type of substance is like a dyed silicone type thing, and then they melt away the rest of the body, but this stays. And that's exactly what your vascular system looks like in your body. It's pretty cool. And over time, again, wear and tear makes your blood pressure go up. What does a vessel look like? They both have these three parts, the same in the veins and the arteries. This tunica, let's see, adventitia, tunica media, and tunica intimae. Intimae, I think is what that's called. But those are the layers of a vessel, whether it be an artery or a vein. However, veins have valves in them, and capillaries actually are even tinier, and then they have those little cells that allow stuff to go in and out via osmosis, and also oxygen is transported in the capillaries. And the signs and symptoms of high blood pressure, and once arteries are stretchy and veins are not, but they have the valves. That's how you get you don't get backwash. So someone that has varicose veins in, say, their feet or their lower legs, that's because those valves have worn out. That can happen at a young age, but usually you see that in people that are older or have had to stand a lot on their feet, and those veins just kind of give way. And therefore the vessel starts to bulge because they get backwash, and they don't have that elasticity that the arteries have. And what do the arteries do? They get aneurysms. They get bulges because the side of the elastic blows out. Just like if you had a pair of pants or a slip and you wore it so much the elastic wore out, that's what happens to an artery. Signs and symptoms. It's important for you to know the signs and symptoms of hypertension, because when a person gets a diagnosis in the outpatient world of a disease, you don't code the signs and symptoms. So how will you know not to code these things if a patient has the definitive diagnosis of hypertension, if you don't know what they are? Severe headache. Now, all of these signs and symptoms occur when that top number starts elevating. Remember, I told you that bottom number, the systolic and the diastolic, that is they call it the silent killer. It goes up and it doesn't give you signs and symptoms. But that top number goes up and you start feeling it. You don't feel good. So you get a headache. You get fatigue or confusion even. Chest pain, very common. Difficulty breathing, again, another common. Irregular heartbeat, because the heart is like trying to catch up. It's working too hard. dun, 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 dun. You can have blood in the urine. Why do you think that every time you go to the doctor, they want a urine sample? And you're like, I don't have any problems with my bladder. Why are you making me get a urine sample? Well, because of things like this. Hypertension. If you have hypertension and you start spilling protein in your urine, sugar, and blood, then that could say that you have hypertension, and thus your kidneys are being affected. Pounding in the chest, neck, or ears. Bounding. Boom, boom, boom. Those carotid arteries, right? The major vessel in your chest, the aorta. Those little vessels in your ears that, if you ever, have you ever smashed your finger and it goes throb, 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 and it does, if you get that in your ears, it's usually a sign that something's up with your blood pressure. Either that or you have an ear infection. But, we don't, at our age, we don't get ear infections like the young ones do. So something might be off. All right. So you don't have to have the anatomy of the vessels memorized. However, remember, these you do want to keep in your memory banks. Arteries are elastic. Veins have valves. I would think that would be. And arteries and veins, they connect at the capillary level. So just wrapping up again, the signs and symptoms, and this little comic where the doctor says, 135 over 80, your blood pressure is too high. That can't be right. You told me to keep it below 140 over 80. The guidelines have changed. Whoops, it just went way up. So anyway, I thought that was important. White coat hypertension. Not because you're nervous, because you're mad at that doctor for telling you all the things that are wrong with you. So let's look at some of our comments. Oh, everybody's saying where they're from. Eureka says, so if I have a combo code and I-10, it's okay to code both, correct? No, I-10 is not used with a combo code. A combo code would replace I-10 for hypertension. I-10 is not a combo code, but I-11, 12, 13, those are all combo codes. They explain that either I2, you have two things, hypertension and CKD, or 3, you have hypertension, heart failure, or CKD. Those are combo codes. I-10 is not. Very good. Okay, we're kind of getting done early. Any other questions before we wrap up? You're going to be tested on this a lot. Lot. All right, good. I'm glad you got that. Here we go. All right, so hopefully this was fun. And for your courses, we're starting up the Wednesday house calls, and that's exclusive for the students. So you don't have to book it or anything. There's a link, and again, it's just a little one-on-one questions. It's not formatted in any way. We're not talking about anything that's been pre-discussed. You just come in, I'm having problems with this test question, or I'm having problems with this concept, like a combo code or something, and we'll just talk through, and we're all just live and talking together. It would be as if we were in a room together in a brick and mortar school. All right. We don't record those. Those are just for us to talk and have our questions answered. And then student webinars usually on Thursdays and club webinars on Tuesdays as a general rule. Okay. Well, thanks guys for attending. And if there is something that you're struggling with, go put it in the forum in the club area or the student area for your course. And, we can answer it there. But if you'd like to do this where we're doing it kind of the one-on-one, we'll do it at the student webinar for you. And I'll give you the full picture, the anatomy, the who, what, when, where, and why. All right, guys, have a great rest of your day.